I've worked in Southern California. I've worked in Las Vegas. And sometimes when you are in a huge city, which is super saturated with different doctors, the doctors get so busy and they do not anymore develop relationships amongst each other. You hear of primary care physicians who are out in the city. They refer patients out to a specialist. The specialist does the minimum that they do, send the patient back to the primary care provider, and there's absolutely no communication between the primary care provider and the specialist. That doesn't happen here. We have a pretty close-knit medical community. I have a wonderful relationship with our surgeons, with our cardiologists. If I have any problems, I pick up the phone, and if I have a question about an EKG or a stress test that I'm not quite sure about, I pick up the phone and I call the cardiologist. Cardiologist is willing to help me anytime. A surgeon, in the process of evaluating a patient, they find out that, oh, I think the patient has developed an irregular heartbeat. They call me and say, could you check on this patient? I think there's something wrong with the heartbeat. That's wonderful to actually have this wonderful relationship with the different specialties. We have a great relationship with our hospital staff. The hospital emergency room doctors, sometimes I give them a call when I have a patient who I'm not really quite sure if they're emergency room material. So it's just a wonderful relationship among the members of the medical community here in a rural area.